And while the number of confirmed coronavirus cases in Ontario remains at 3, more and more people are being tested for the respiratory virus. As these investigations continue, health officials are also widening the surveillance for those who need testing. Here's the latest on the coronavirus numbers in Ontario. 169 tests have been administered so far. Of those, 104 were ruled negative, while an additional 62 are currently under investigation. That's nearly double the number of cases that were under review on Tuesday.
Most of them are people who have traveled and have symptoms.
Those who were on the flights were asymptomatic when they boarded. Others realized they may have made contact with someone who had the virus. And doctors are testing more and more patients who don't necessarily exhibit symptoms but have traveled to affected areas.
A number of them may have not been in Hubei province. They might have been in other parts of China or elsewhere and been around a case and now have symptoms, and the doctor taking care of them is concerned and in consultation with public health has decided to err on the side of caution and testing them.
Ontario has 3 confirmed cases of the coronavirus, 2 of which are in Toronto, the 3rd in London. These patients are currently at home in isolation. But for how long?
They wouldn't be what we call released from isolation measures until we have 2 negative tests on them, at least 24 hours apart.
As the situation evolves, officials are winding their surveillance outside of just Hubei province, ground zero for the respiratory virus. It's been 14 days since part of China were quarantined, the maximum incubation period for the virus. Now provincial and federal officials here at home are also expanding on the case contact tracing, including Canadians who are returning back to Ontario within the 2-week period.
So how do we ensure ongoing, because of their proximity to the area of concern in Hubei, they may not have had the same impact that the centres did. Nevertheless, they may have had more potential for inadvertent contact, and we want to be sensitive to that. And how do we handle that in the right way, the most sensitive way?
So if you are concerned or have questions, you are asked to contact your public health officials for further instructions. Meantime, there are 2 new presumptive coronavirus cases in BC. The patients are a man and a woman, both in their 30s. They had visited Hubei province. The provincial health officer says they are linked to a woman who was diagnosed earlier this week. If all those are confirmed, it would bring the national total to 7. For more on this, you can head to our website, citynews.ca.